Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Arthritis is one of the leading causes of disability in the United States, and it's extremely common. In fact, 1 in 4 people over the age of 18 have doctor-diagnosed arthritis, meaning that they've been to the doctor and they've actually been diagnosed with arthritis. There's probably a lot more people that have arthritis that don't know about it or haven't been to the doctor. And it's estimated that the economic burden of arthritis is close to $130 billion every year in the United States. Arthritis, of course, is inflammation of one or more of your joints. The main symptoms of arthritis, well, everybody knows. It's joint pain and stiffness, and it tends to get gradually worse over time, gradually worse as you get older.
The 2 most common types of arthritis are osteoarthritis, also known as wear and tear arthritis, and rheumatoid arthritis. And here to discuss arthritis and its impact on individuals and society is Mayo Clinic rheumatologist Dr. Eric Matteson. Welcome back to the program, Dr. Matteson. It's nice to see you again.
Thank you. It's great to be here.
Good to have you here. Arthritis, an extremely common problem, and it affects and costs this country a lot of money.
That's for sure. In fact, new estimates of arthritis prevalence show us that more than 90 million people in this country have arthritis. And the newest studies show us that a surprising number of people under the age of 65 have arthritis. Probably more than 35% of people over the age of 18, between 18 and 65 have arthritis. And so this is an enormous number of people. And the disability that's associated with that, the healthcare costs that are associated with that, and the personal costs of the patients because of how arthritis affects us in our hobbies and in our jobs, our daily lives, is enormous.
So I actually underestimated the number of people who have arthritis, more than most people even think.
Yes.
And just like any other time when we have interviewed you, as soon as we start talking about it, I start kind of checking, how are my fingers feeling? And I think, well, they kind of ache a little bit. Is that arthritis? Is pain arthritis? What do you consider arthritis to be?
Well, arthritis does cause pain, and it causes dysfunction in the joints. So when we think about arthritis, what we're thinking about, like Dr. Shives mentioned, we're thinking about inflammation and damage that's occurring in the joints. So not every joint pain, not every muscle pain that we have is arthritis, but the persistence of pain in the joints, especially when it's more than 6 weeks, 8 weeks, 12 weeks, and longer, probably does represent arthritis to some extent.
And what causes it?
Well, there are lots of causes of arthritis. In fact, there are more than 200 forms of arthritis. Some forms of arthritis are caused by deterioration as we get older. Sometimes we have genes that are a little weak that make our cartilage, so our cartilage deteriorates faster, and that causes arthritis. Trauma causes arthritis. Some jobs that people do, for example, we know that people that spend a lot of time, for example, laying floors and carpets have a lot more arthritis in their knees. We have arthritis that's caused by metabolic disturbances like gout, for example. And then there are all of the autoimmune diseases, such as rheumatoid arthritis that you mentioned, which also can cause arthritis.
So let's tell our audience, what's really happening here is that the cartilage is damaged. The cartilage is being destroyed. And that's the glistening white layer over the end of bones. If you open up a chicken bone and you look on the end of the bone, there's glistening white tissue. That's the cartilage. And as arthritis means that cartilage has worn out, but in fact, cartilage doesn't have a blood supply, doesn't have a nerve supply. It's nourished by the joint fluid. So the pain is really not caused from the cartilage degeneration. It's caused by the associated inflammation, correct?
Right. The associated inflammation and the effect of the cartilage damage on the underlying bone. So there's the cartilage, as you said, lays right over the bone, and when the cartilage deteriorates, the bone also deteriorates and breaks down.
And the bone's got a blood supply.
That does have a blood supply
supply
and nerves, yes. So that's
but
why
isn't
we have
it
pain.
interesting that the cartilage doesn't have a blood supply nourished by the joint fluid?
Right. Mm-hmm.
So we don't really have an idea why this all happens and why it's so common. And it's not a new disease. People have had arthritis forever, right?
They have had arthritis forever, although it does seem to be more common today than it has been in the past, and we're not exactly sure why that is. One of the speculative reasons is because we simply are bigger in our society today than in the past. We have more weight. Our bodies are larger. We carry more weight. There's more people who are obese, overweight than in the past, and there's a direct relationship between being overweight and developing arthritis. So I think that's one of the reasons why we are, in fact, seeing more arthritis today than we have in the past.
We've gotten too big.
Well, that's then the first risk factor for developing arthritis?
That's a major risk factor for developing wear and tear arthritis.
What are some others?
Well, we know that smoking, interestingly, is associated with developing arthritis, although we don't know exactly why that is. It's more commonly associated with rheumatoid arthritis because smoking actually triggers the immune system to become more active in a way that we are exploring here at Mayo Clinic, but we're not exactly sure how this happens. But we know that it is a fact, and we know that smoking can induce the development of certain proteins that are immunologically active in our immune system, that eventually go on to attack the joints and destroy the joints.
You know, in the introduction, we said that arthritis is the leading cause of disability in the United States. But when you compare that to back pain and headache, is it really number one?
I think that it is number one. In fact, if we think about some causes of headache, are deterioration of the bones and cartilage in our cervical spine, in the spine of our neck. And when we even talk about back pain, we're often talking about arthritis, in fact, with deterioration of the discs, which are cartilage also, and the bones of the vertebrae of our spine. So even there, arthritis plays a major role in causing those back pain symptoms.
People probably don't think about arthritis in their back. They think about their knees or their hands, their fingers, but arthritis in the back is very common or not common?
Very common.
Yeah, so there are little joints that have cartilage on them between all the vertebrae, and they're called facet joints. Mm-hmm. And just like any other joint in your body, those can wear out.
Boy, you are so smart. I had no idea.
This is
I've
not
sat
my
next
first
to you
rodeo.
all this time, and look at you.
So you talked about, let's go back to the risk factors again. So obesity was one. Family history is another, isn't it?
Family history is very important. There are definitely genetic predispositions to almost every kind of arthritis. And we know of families where there are inherited weaknesses of cartilage genes, so that the genes that are responsible for making cartilage don't make strong cartilage. And those families are predisposed to developing arthritis, for example.
Anything else? So obesity, family history, smoking.
I think those are some of the...
Those are the big ones?
Those are the big ones, and trauma.
All right, let's talk about a minute about the economic impact. And is that because people are unable to work because of their arthritis, or does it also have to do with the cost for caring for these patients?
It's both of those things, of course. So work time loss is a major reason for a loss of productivity in America, and it's one of the indirect, we say, costs of having arthritis that runs into the billions every year. And then, of course, there are the costs of taking care of the arthritis as well. So all of the medications that are necessary, the doctor visits that are necessary, and the surgeries that are necessary, as well as some of the other therapies. For example, physical therapy and rehabilitation, that's very important for management of arthritis. All of those things entail huge costs, and you mentioned that those costs are over $130 billion per year. That's easily the figure that's reached because of arthritis.
Amazing. All right, rheumatologist Dr. Eric Matteson. We're going to take a short break. When we come back, we're going to talk about all the treatment options there are for people with arthritis. Plus, we've got a myth or matter of fact.
That's right, and this is always a popular question. Cracking your knuckles can cause arthritis. We'll find out. You're listening to Mayo Clinic Radio on the Mayo Clinic News Network.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
We are with rheumatologist Dr. Eric Matteson talking about the impact of arthritis, how common it is. We've talked about the risk factors. We've talked about the economic impact. And now it's time for myth or matter of fact.
This little factoid is always so popular when we tweet it out or...
Everybody knows the answer by now, don't they?
No, because it just keeps going on. So myth or matter of fact, cracking your knuckles can cause arthritis. Is that a myth or a fact, Dr. Matteson?
Were our mothers right or not?
Regrettably, it's a myth. And I say regrettably because it is an annoying habit.
All right. Good to know.
Yeah. All right. Let's talk about treatment options. We know there are a lot of people who have arthritis. We know that being obese, smoking, having a family history increases your risk for arthritis. But we also know you've got a lot of treatment options. So let's start with, I guess, medication.
So for wear and tear arthritis, medications basically are used to help with the pain. And we know that arthritis does cause a lot of pain, so medications such as acetaminophen or Tylenol or what we call nonsteroidals such as ibuprofen, Aleve, Motrin, Naproxen, those kind of medications can help to relieve the pain, but they do not change the structure of the cartilage of the joints, unfortunately.
They don't change the course of the disease.
They do not.
Now, is it true that because we know, and we've talked about the fact that it's the inflammation associated with the arthritic process that causes a significant amount of the pain?
Right.
Wouldn't it make sense that the NSAIDs, the non-steroidal anti-inflammatory medications, work better than Tylenol? Acetaminophen, because acetaminophen is not anti-inflammatory, but the other ones are?
That is true. And so for many people, it is in fact the case that the NSAIDs work better for reducing pain. But if there's not a lot of inflammation involved, then Tylenol may work just as well. So it's something that each individual has to see for themselves what works the best for them.
What kind of therapy works for people with arthritis? Is there physical therapy that works?
There is physical therapy that helps. I think that the things that are most helpful are strengthening the muscles around the joints and physical activity. Actually, walking, swimming, biking are the things that help the most. If our muscles become weak, our joints take more of a beating. And so these activities are really important for managing arthritis.
So those activities that you talked about are non-impact activities. So for example, an elliptical would be much better for you than a treadmill if you've got hip and knee arthritis.
Yes, I think so.
And swimming?
And
absolutely
swimming is
the best, huh?
Is a great exercise, right?
It doesn't help much for osteoporosis or osteopenia because you're not stressing your bones to keep them strong, but it's best for the arthritis.
I think so too.
Alternative treatments. I want to ask you about those. Now, you know what? We better talk about surgery first because everybody's had a total hip or a total knee, haven't they? Or they're in line for one.
Is surgery the last form of approach?
Well, today surgery is what's needed very frequently, and I think that more than 1 million people in this country every year undergo hip replacement surgery, and more than 1 million people undergo knee replacement surgery. So that tells us what a great impact the arthritis has. And unfortunately, that's where it comes down to sometimes for our patients.
You know, I've heard you say that I'm older than dirt, and that's close, but I just want you to know that.
I didn't know you heard that.
I worked with Dr. Mark Coventry when I was a resident here, and it had been about 3 or 4 years previously that he had done the first total hip in the United States. And he went over to England and learned the technique from Dr. John Charnley, who invented the total hip. And back in those, even in those days, we were doing total hip, and total knees. And things are better now. The surgery's better. The surgery is faster. It's easier. The prostheses are better than they used to be. But we've been doing these for a long time.
Is there any effect that maybe this is the power of great advertising or it really does work, but is there any effect of glucosamine chondroitin on joints?
Well, Dr. Shives mentioned that the cartilage doesn't have a blood supply. So when we think about how chondroitin might work or glucosamine might work, these are substances that are actually manufactured by cartilage cells. And the cartilage cell actually is only capable of using the glucosamine that it makes itself. it cannot take up the cartilage that we ingest, that we put in our mouths, that goes into our bloodstream. It simply does not get to our joints. Now, some people do get pain relief by taking glycosamine, but what we don't get is new cartilage.
One of the most important things that I know that people can do that we should probably emphasize, in addition to activity and strengthening exercises, is losing weight.
Yes, that is a major risk factor, like we pointed out already, and it is the major thing beyond the activity, the strengthening that an individual can do for themselves to reduce their arthritis risk, and even if they have arthritis, to slow down the progression of that arthritis.
To that point then, is there any dietary measures that people can take aside
Yes.
from losing weight?
There
Yes.
must be an arthritis diet that someone has touted.
Yes, there are many arthritis diets, and the most effective arthritis diet that there is calorie reduction.
Yeah.
The exercise of pushing yourself away from the table 3 times a day is probably one of the most effective things that we can do to reduce our arthritis risk.
All right, what's new in research, and can you grow new cartilage?
You can grow new cartilage. You can grow new bone. The problem is so far that we haven't really figured out in the average person how to get it into the joint so that it will stay, so that it will stick and not deteriorate after it becomes, after the patient starts using that joint again. Preventing the breakdown of those newly implanted cells is a real problem still.
So you can grow them in the petri dish. You can grow them outside the body, but when you try to grow them inside the body, they just don't stay. Don't stick.
That's right. For most of us, that is the case. For very young people, it's a little bit different. They still have growing bone and cartilage, and sometimes you can fill in defects in younger people. But for most of us, it's still something that's in the future.
What else in research what might people be interested in finding out?
Well, there's a lot of things that are happening with 3D printing and making new, what we call matrices that are put into the joint and having cartilage and bone cells grow around these matrices. That's something that's quite exciting that's coming along. And in the field of inflammatory arthritis, such as rheumatoid arthritis and autoimmune diseases, we have a whole host of medications that are very effective in reducing the inflammatory disease, in reducing the joint damage, and improving the quality of life of people who have rheumatic arthritis, rheumatoid arthritis, psoriatic arthritis, and related forms of arthritis.
Yep, and until you get that all figured out, their best options are medications, surgery, last
Yes.
resort, but it works really
It
well.
works really well.
And therapy.
Yes.
All right, Dr. Eric Matteson talking about the impact of arthritis, a common problem in the United States. Thanks so much for being with us.
You're welcome. It's very nice to be here. Thank you.